Dr. Misra, just like Dr. Sulfi pointed out, back with SARS-CoV, it was very novel. We did not know about it. The first patient in this particular case also reportedly died before Hantavirus was even suspected or diagnosed. Rare infections, are they still too difficult to diagnose quickly, even in this hyper-connected world that we're living in such an advanced medical setup? It is still difficult when it comes to diagnosing these rare infections.
See, many of the viral diseases, they have the same kind of symptoms. So just by looking at the symptoms, sometimes it's very difficult, because when a patient comes, you think of the common diseases and common symptoms and the common test which you do. But the thing here is, in the ship, any ship, the facilities, they are limited for the testing and the treatment. We have certain lab tests available for hantavirus, which we don't do in the regular practice. The issue here is, when most of the people, they are worried about the pandemic potential of this virus, and they compare it with the COVID, because the COVID was the recent pandemic which everybody has experienced, and experience was difficult for
Yep.
utilize. So here it is, as an epidemiologist, what I can say here is that it has very low potential for that. So as from the public health point of view, there is a very low threat. There should not be any cause for panic.
Okay.
We should keep an eye, we should keep an watch on these people, where they are going, and all the public health authorities in most of the countries, they have a system how to track these people, what to do next, so that we can limit infection. Now we know there are people from different countries in that ship, and they have come in contact with this virus, and this variant of virus can spread human to human as well.
Yeah.
So even if they disembark the ship, now we know about that this has happened in the ship. I'm quite sure that public health officials from different countries, they will keep track of these people. So there's a very low possibility of getting people infected. The other thing is, even if infection is there, how rapidly it is spread, that is an important factor. Like in COVID, we have seen that it was through respiratory route, and people, they were getting infected. The other factor which you might have heard, are not, that how many people can get infected from one case. So all those factors we keep in mind.
Yeah.
For this virus, this is here for decades. From 50s, we know about this virus. There are cases in different countries, including US. Even the cases have been reported from India earlier. That's in the literature. And there is a study which has found that even in the healthy blood donors, there were around 6% people in a small town, I mean, where it was done in South India, they have found the prevalence. So antibodies are there in 6% of people. This is well-known virus for long, and the potential of spreading too fast like COVID is very unlikely.
Okay.
So I don't think there's any cause for concern from public health potential.
That's the silver lining here. We know about this. It's there in the literature. Literature might not be as robust, but there is enough data on this particular disease.